Jimmy, what's the truly full arch residency program?
So we know that 20% of the world's population needs full arch, and what we want is we want a situation where we can help train young dentists to become full arch surgeons. We do about 200 full arches a month, and what that means is there's a lot of volume here for us to not only help people but also train people. What we want to do is we've created a continuum that starts from step 1 all the way to being an independent full arch zygomatic and pterygoid surgeon, and that includes an inbuilt master's, training in our live patient facility in Dubai, and also teaching to an extent. And basically we want to be able to equip that person to tackle any full arch case that they can and to help any full arch patient that they need. If you want to apply, just DM us on socials or follow the link below to get more information. The ideal candidate is a young dentist who's looking to get specialized in implants, who knows that the surgery is something they love, or even someone who's a little older and who's done a lot of general dentistry and they want to move into something different. We want everyone to try and apply, and we want to get every single person in the world who needs a full arch some treatment. So the more help we can get, the better, and this is step 1 to doing that.
So Jimmy, what's a typical day look like for a truly full arch intern?
A full arch intern can expect to do at least 2 arches a day, and the idea is that we have so many people that need this treatment and we have very few people who can provide this treatment. So what we want to do is we want to create more of these people, and therefore there'll be at least 2 full arches a day. There'll also be a mix of wisdom teeth, oral surgery, single implants, grafting. So your day will never be dull. You know, there'll always be some surgical hands-on aspect, and what that does is it creates lasting skills and lasting kind of muscle memory that's going to lead to you becoming a really independent and skillful, and also someone who's going to be helping these patients when you're doing full arch. So it's all about hands-on skills, it's all about muscle memory, it's all about learning, and that's the kind of environment that we provide with the hospital and other truly practices. There's something that you just can't miss out on. Every day you get to learn something new, every day you experience something new, every full arch is a different experience.
And what about complications? So when full arch interns have a difficult case or they want help with something, you know, do they have the support structure there?
Yeah, so our senior full arch clinicians like myself, yourself, and the rest of the team are always here. We're always available, and we're always going to be there in a one-to-one kind of basis for each intern. And what we want to do is we want to make it a safe environment that if they ever feel, hey, you know, this is beyond me, someone's always around. And the aim isn't that we want to be heroes and rescue the situation. The aim is that we want to educate in that situation so that that problem isn't actually a problem, it becomes a learning experience. So we want to create opportunities for people to get better.
And will full arch intern do just the surgery or the prosthetics or a mix of both?
No. At Truly, we value the fact that our surgeons do everything from start to finish, and the reason that's valuable is because if you don't have the end smile in mind, you can't do the surgery properly. So training someone to do just the surgery or just the prosthetics is a disservice to our patients. So what we want to do is we want to create, you know, that ultimate player, that Lionel Messi, that Ronaldo, who can start to finish. He can start the play, he can score the goal, and he's going to create those smiles.
Yeah. So we teach the treatment planning, digital smile design, the technical side of it with our lab and understanding what happens in the lab, the surgery and the prosthetic.
Yeah, the whole reason it's a residency and it's done over a period of time, like a continuum, is so you have time to gather the information, to learn these skills. You do spend a period of time in the lab. You will learn to maybe mill and sinter some cases. You'll learn to layer ceramic. You'll learn.
So you get a comprehensive understanding.
Yeah, because you have to understand everything to really understand the basics of why you do a treatment and why it works, right?
Yeah. So will interns and residents get an opportunity to manage complications as well and to see complications?
Yeah. So we've created a tiered system. So based on that intern's tier and how they advance through the process, they'll be seeing more and more complications and more complicated cases. We're very proud of the fact that we have few complications in our practice in general, and that's because our workflows are very stringent on how full arch should work. But we appreciate that these things always happen, and as interns get more experience, yes, they'll get exposure to this.
Yeah, and I think they get to review the cases that we've kind of done 5+ years ago now, is to see how the kind of tissue is holding up and maintaining those cases. So it's a mixture of surgery, pros, is soft tissue surgery.
A strong part of it is patient communication as well, right? And we really want to teach people how to speak to patients, how to treat them, how to make them understand what the treatment is for, why they're having it, how to manage expectations. So it's not just a, hey, this is how you do a full arch, see you later. It's a, this is how you see a patient, this is how you create a smile, this is how you deliver a smile, and these are the steps behind it. So we want you to learn everything, because that's what we went through to create this workflow.
Yeah. And typically, how many hours a week does a full arch intern or resident have to do, and is there any on call? You know, there's a lot of dentists have done kind of hospital jobs. Is it like that, or is it a bit more chill?
No, it's like working like a normal implant dentist. You know, your hours are regulated as per normal. At Truly, we're open 7 days a week, 8 to 8. So what we want is we want to be able to provide a service at all times. So we expect the interns to work the same time as their registrar or consultant is there.
Yeah.
So it's the same kind of like a hospital-based system people will be used to. There will be overnight shifts available, but that's something to consider later on. But what we want essentially is that when your senior surgeon is there, you're there, because that's when you're going to learn the most.
Yeah, and you have that support at that point in time, so you can do the surgery and not
we know
be
from like decades and centuries of medical and surgical training that the way system works best at the moment is that there's a consultant, there's a registrar, and an intern, and that's because you're shielded and you're protected from the fact that if anything happens, there's someone there to help.
Is IV sedation training kind of provided as part of the...
Yeah, it's part of the continuum. So early on in the continuum, the things that you would be focusing on are your extraction skills, your grafting skills, your soft tissue management, and your sedation. Yeah. So sedation would come under the patient management aspect. Yeah. Then there's a surgical aspect, and then there's a restorative aspect. So we tend to have a focus on each of those at different points of the continuum, but early on it's the patient-centric aspect. So learning how to treatment plan, learning how to diagnose, learning how to do IV sedation. We will be your mentor for your 20 cases that you need. We'll guide you on how to do that. We'll teach you cannulation, how to manage these patients. And then later on in the continuum and residency, that's when you focus on the surgical and prosthetic aspect.
Yeah. That's amazing. So if people want to apply for the intern or residency program, how do they do that?
So you can just reach out to us on social media. You can DM either myself or Dr. Sheeran as well, or you can click on the link below to see the landing page and see how you can get more information.